Laquandra Nesbit. I serve as one of the perinatal community health workers for Mama Toto Village. I provide childbirth education, housing navigation, support with social benefits such as SNAP, TANF, WIC, and SSI. I also support my clients with postpartum support and newborn care. My experience birthing my son in 2016 was very traumatic. I was a 20-year-old junior at North Carolina A&T. I traveled 5 hours on the bus each month for my prenatal visits because I truly believed that DC had better obstetrics and maternal care than where my school was located. After no pregnancy complications and laboring at the hospital for 32 hours, I birthed my son via emergency cesarean and endured 4 blood transfusions due to postpartum complications. I was terrified, alone, and left feeling like I failed at something I truly believed I was destined to do. The hospital staff were rude, cold, and didn't listen to any of my concerns, and I experienced postpartum depression due to that horrific birthing experience. The next year, I graduated college with my son on my hip and vowed to speak out about my experience and lack of support during my labor. To any expectant mother that would listen, I hope that sharing my story would somehow prevent others from having the same experience. My next birthing experience was entirely different. I took control of my prenatal decisions, connected with Mama Toto Village, and received unconditional support from a team of Black women that I would never forget. They shared their experiences, held space for me, and reassured me that this was the definition of a village. In 2020, I had a successful VBAC with the birth of my daughter. My amazing birth worker through Mama Toto recommended that I also take the training to become a perinatal community health worker. That summer, my 6-month-old and I completed the training and passed the course. I began working at Mama Toto that same year. For almost 2 years now, I've been able to provide physical and emotional support as well as guidance to birthing people, women, children, and victims of domestic violence through childbirth education, housing support, connecting to community resources, and most importantly, being an advocate for birthing people's reproductive rights and their ability to parent in the way that they desire. The best part of my job is having those full circle moments where clients recognize their own autonomy in their birthing decisions and parenting choices and say, hey, I want to do this work too. That is the definition of a village. Jennifer L. Porter was appointed to serve as Executive Director of the Mayor's Office on Women's Policy and Initiatives by Mayor Muriel Bowser in February of 2019. In this role, she serves as the Bowser administration's chief advocate for women and women's issues in Washington, D.C. As director, Jennifer collaborates with local and national nonprofit organizations and public agencies to address the needs of women. Mrs. Porter advises Mayor Bowser on women's policy and areas of need for women initiatives. Director Porter holds a degree in biology from Howard University, a master's of public health from the George Washington University Milken Institute School of Public Health, and is a master certified health education specialist. Prior to her appointment, Jennifer led a public health career in government relations and adolescent health advocacy. I would like to introduce Jennifer Porter, Executive Director of the Mayor's Office on Women's Policy and Initiatives. Thank you.
Thank you so much, and thank you for sharing your story. Happy Black Maternal Health Week, everybody. Yes, as she mentioned, I'm Jennifer Porter. I have the honor of serving as the Executive Director of the Mayor's Office on Women's Policy and Initiatives. It's a beautiful day here in Ward 7, and we're excited to celebrate Black mothers, Black care, and Black health for women. On behalf of our mom-in-chief, Mayor Muriel Bowser, who couldn't be here, we're standing in the gap with her, and we're standing here on behalf of her because we know with our mayor the work continues, and we're excited today to celebrate the great work and investments that we'll talk about today. I also want to acknowledge Today, as we stand here, the Black Mamas Matter Alliance, as we join them this week and throughout the year in acknowledging and celebrating and centering Black maternal health care, we congratulate them on 5 years this year on this observance, but a lifetime of work committed to centering Black moms. So congratulations to the Alliance, and we're proud to partner with you in this work. Next, I also want to acknowledge the amazing Black women in government leadership who are leading healthcare, who are helping to build and better the health infrastructure here, and our Black women community leaders, one of which we're highlighting today and celebrating. But I also want to acknowledge my colleague and one of my sheroes, Dr. Laquandra Nesbit, who we'll hear from shortly today. But as we talk about Black maternal health, I'm proud to be here in DC where there are Black women who are leading in the decisions and the discussions that we're having and the interventions that we're investing in. We know when we have women at the table, the representation of the outcomes look different, and so I'm grateful for that. And one of those outcomes I'm excited to highlight from our mayor. In 2018, she launched the National Maternal and Infant Health Summit and the Thrive by 5 initiative with the aim to connect families and caregivers with a community of resource education and support to have the best possible start for DC children. This event over the years has convened thousands of families, thought leaders to learn, to collaborate, and to grow. And we're excited that this year we'll be hosting the 5th annual Maternal and Infant Health Summit. We know that this year, our aim is to further the pathway to equity for Black maternal health, to make sure that we're increasing the understanding and awareness of maternal and infant health in DC, to develop and disseminate solutions, and to implement sustainable actions. So we're excited to have each of you all here, and we're looking forward to each of you all joining us in that work started by our mayor. We look forward to every year not only commemorating the convening, but highlighting the innovation that's happening right here and across the country. And one of the innovations that we were excited that the mayor launched this year is our Strong Families, Strong Futures pilot. And many of you all may have heard of it, but we're excited that this is a new direct cash assistance program supporting new and expectant mothers residing right here in Ward 5, 7, and 8 during that pivotal first year. And we'll hear today and celebrate some moms who are in those pivotal moments and coming into those pivotal moments. But that direct cash assistance for those families truly is a financial start and financial foundation that is paving the way for pathways for success. The pilot cohort, this first cohort, includes 132 mothers, and they will receive $10,800 over the course of the year-long program. And that's an investment that's worthy of us commending, because it's not just an investment, but it's an opportunity for us to learn. And we're looking forward to working with our government partners, our community partners at Martha's Table to learn how best we can invest in moms and support them. This investment also includes, in addition to the monthly cash assistance, access to Martha's Table's benefits, including weekly healthy groceries, children's professional clothing at no cost to our moms, the opportunity to enroll their children in nationally accredited early education to prepare their children for success and for kindergarten and beyond, and the chance to build community and build relationships with other parents. We know that it takes a village to raise children, but it also takes a village to raise moms, right? And building that community is so important. So we're excited to highlight that, those investments and more. One of the investments we're here today to celebrate is the opening of this new beautiful center right here, Mama Toto Village. And I'm so excited about the work that they're doing to center birthing people, to center Black women, and to center their care. And so, and specifically centering their care in this area of our city where it's needed and where it should be celebrated. So I'm excited to celebrate with each of you all and to introduce my colleague, Dr. Laquandra Nesbit, who is the director of the DC Department, DC Health, our DC Health Department, and is just a renowned Black woman leader who we're celebrating today and who's going to talk about some additional investments on behalf of the Bowser administration. Dr. Nesbit.
Thank you, Jennifer. It is indeed a beautiful day. It's also a remarkable spring day here in D.C., which means we are, in addition to be graced by so many remarkable women, we're graced by so much remarkable pollen. So you'll pardon me for the voice that I have today. My name is Dr. Laquandra Nesbit. It's indeed an honor to be with you all here in Ward 7 as part of Black Maternal Health Week, which is such a critical thing that we bring attention to and that we honor and we celebrate. I think that part of the spirit of Black Maternal Health Week is for us to give honor to and to recognize that while pregnancy and childbirth is such a remarkable and joyful experience for so many people in our world and in our country, it also can be a time of great anxiety and also a great time of frustration, unfortunately, for many Black women in our country and here in our city. And so being able to pause and during this week bring some recognition and bring some much needed attention, conversation, and more importantly, action to things that we can do to improve the experience for Black women who are pregnant and giving birth and then going on to raise children to be remarkable members of our society, I think is extremely important. I'm very excited to be here today at Mama Toto Village here in Ward 7 with its co-founder, Aza, and celebrating their expansion here in Ward 7 and all of the remarkable services that they have continued to provide even during this once in a 100-year global pandemic. It's been inspiring for us to see leaders in our community be committed to their mission, be committed to the population that they serve, and truly be in service to our residents, even sometimes at risk to their own personal health and personal safety, and putting others before themselves. So I want to honor and acknowledge you all, you and members of your team, for staying steadfast to your commitment. I am just so remarkably moved and inspired by Kyra, her courage, her bravery, and her willingness to share her story with us. That I am gonna talk about what we're doing in DC, but I'm gonna talk about why we do what we do. And Kyra talking about her story and sharing that in 2016, she recognized that the District of Columbia has world-class health care, and recognized that world-class health care and made a conscious decision in 2016 to take a bus ride 5 hours to come get health care during pregnancy. And I think some of you know that when you are pregnant, you get a lot of health care. So that wasn't a one-time 5-hour bus ride, was it, Kyra? That was a frequent 1-hour bus ride that you decided, consciously made a decision that you wanted to receive your health care here in Washington, D.C. Now, I've had a long time. I've been working in D.C. off and on since 2008, and I came back to D.C. in 2015. And issues of perinatal health, how we take care of our moms and babies, and being able to have every baby born in Washington, D.C. celebrate its first birthday is very important to me. And how we take care of our moms who raise these babies is extremely important to me. And so when I came back here, being invested, truly invested in our programs and initiatives for our moms was really important. And so us having a myopic focus on home visiting as our panacea and our solution, I knew was not going to work. And so we needed to expand and really be committed to listening to our community and listening to people and actively seeking out what existed in our community that was going to work for people. And you can see since 2015, we have expanded what we invest in, listening to our community. So we continue to invest in home visiting. It's extremely important. Having evidence-based home visiting programs that are based in community-based organizations, that are based in healthcare organizations, our federally qualified health centers, that refer people to home visiting, them connected to WIC and all of the SNAP services. Everything that people are qualified for is extremely important. Going into people's homes and doing assessments for postpartum depression or before they deliver, making sure that they're showing up to all their appointments are extremely important. But part of Kyra's journey and her talking about her experience in 2016 and not being listened to has made us recognize that we need to invest in more perinatal health workers and we need to invest in more doulas, people who help you understand how you need to navigate that perinatal period, that postpartum, immediate postpartum period, advocate for yourself, have those conversations with those healthcare providers, those physicians, even those midwives who need to be attentive to what your body is experiencing. So we're doubling down and we're making more investments in that. That bore our commitment to working with Mama Toto Village more closely and training more perinatal health workers, right? And making sure that we have doula certification in the District of Columbia now moving forward. All of those things are because we have listened to people like Kyra and making sure that what her first experience was like in 2016, that she would not have that same experience in 2020, and people coming after her won't have that experience moving forward. Another critical part of Kyra's story was saying people deserve to parent how they want to parent and raise healthy children, and to build strong communities as part of a village. And so the model of home visiting will work with many families, but other families need a very place-based, village-based approach to getting guidance from other people who have walked that journey before and have had positive outcomes. And this village-based approach here at Mama Toto Village is something that we need to listen to and we need to replicate. So again, not a one-size-fits-all type of solution is going to work for our women in the District of Columbia. And that's what Maternal Health Week is really all about. So I did grab the little T-shirt because we have these little onesies, and it's also on my water bottle. It's also on the bags that all of the moms here will get and all of the program participants will get. But it's how we think about perinatal health and mom and baby health in the district. And it starts, the little pink bubble at the top starts with every teen girl and woman is in charge of their reproductive health. They are in charge. We are not in charge. They are in charge. And it goes around to really talk about how we need to meet people where they are, how services need to be embedded in the community, how we can do things that are home-based, how we can do things that are in place-based, how services that are provided in clinical environments need to be high quality. And so in our FY23 proposed budget, we are continuing to expand those investments, $3.4 million invested in those clinical quality improvements to reduce preterm birth, continuing to invest in doula services and perinatal quality improvement services and community-based services and home visiting services. All of those things we want to continue to expand and be able to be responsive to what women like Kyra are asking us to do on a daily basis to be able to get the outcomes that they so richly deserve. So we're committed to being a partner, not only during Black Maternal Health Week, but every single day here in Washington, D.C. So I look forward to continuing to work with you, Aza, and all of your staff here at Mama Toto Village and the many community-based organizations who are doing this work day in, day out. Thank you.
Thank you, Dr. Nesbit and Director Porter. And thank you, Kyra, for sharing your amazing story. When Cassetta Pringle and I started Mama Toto Village, it was a great idea. It was born out of our shared need and desire to create what we needed for ourselves, a village, a space for Black women to love, to nurture, uphold, and support one another and our children, and to give validation to the intersectional experiences of our lives that connect us and demonstrate our beauty, our innovation, and our resilience. I stand before you today during the 5th anniversary of Black Maternal Health Week, a week that celebrates the joy in Black mothering and parenting, that raises awareness about the impacts of racism on Black women and birthing people, and that leans into our possibilities and our power. I stand in front of a space that is a physical manifestation of our collective dreams and investment of our time, our energy, and our love.
It represents the mamas, the babies, the fathers, the aunties, the grandmothers, the funders, and more importantly, the community who stands with us and has validated for us that we deserve to be here, that we have earned the right and the trust to occupy this space. This is our legacy. This space is about having a generational impact and being an example of what is possible when we all show up to care. When Mama Toto Village opens our doors in May of this year, we will write a new story. The story that culturally resonant, dignified, high quality, community-based maternal health care is here east of the river. We have so many exciting services that we will be offering in this new location, as well as continuing some existing ones. So our Mothers Rising Home Visitation Program, which is for families that need more intensive support during pregnancy and postpartum, including daytime and overnight care, will continue as well as be more expansive. We will continue to engage in community doula support, have perinatal mental health resources. We will be opening our lactation clinic, dispensary, and milk depot. So if you are a mama or a parent who needs breast or chest feeding support, donor milk, if you have questions about formula feeding, if you're unsure of what your lactation plan is, please reach out to our amazing lactation team who is led by Mama Toto's co-founder and IBCLC Cassetta Pringle. We are kicking off our volunteer programming and expanding our Mama Baby Closet, our food pantry, and internship opportunities, including opportunities for medical students to engage in more community-based training. We have a bigger training room so that more people can participate in our perinatal workforce and birth worker training, advocacy workshops, and community gatherings. We have a spacious kitchen for our wellness programming and are bringing back our Blossoming Bellies, which is our nutrition and cooking classes for pregnant and postpartum mamas. And lastly, but definitely not least, we will be launching a full-service midwifery clinic coming this fall. We will be offering prenatal, postpartum, and well woman care, as well as supporting birth in all settings. As you can see, I'm so excited and cannot wait to welcome you to your village. We hope that you will join us for our grand opening and ribbon cutting ceremony this May. Before I close, I want to thank the amazing women and men who work in Mama Toto Village and who have made all of this possible. Our board of directors who give so freely of their time and connections to move this work forward. And I especially want to shout out my Director of Operations, Brianna Green, who rips and runs up and down this road to make sure all of this was possible. I want to thank the A. James and Alice B. Clark Foundation for your contribution that made the purchase of this building possible, the Kafers Foundation and all of our donors, some of who is here today, our peer fundraisers and supporters that have contributed to our capital campaign. I want to shout out Rosewood Strategies for locating this space and walking us through the maze of acquiring a whole building, and all of the families who support us and have allowed us to care for you. If you would like to support us in getting to our $2 million goal of bringing these amazing services east of the river, please visit us at mamatotovillage.org or at themovementisforever.com. So I hope y'all are ready to get a sneak peek of this amazing building. Thank you.
Thank you, everyone, for coming, and thanks for your continued support. Again, we are not only celebrating today, but we're celebrating all week and all year. But just a really quick announcement, the amazing specialists and team at DC Health is partnering with the Mayor's Office on Women's Policy and Initiatives today at 1 for a very special Black Maternal Health Week Twitter chat. So you can follow us at DC Health and at DC MOPI. That's at DCMOWPI. Join the conversation. Let us know your thoughts, and let us continue to elevate Black maternal health in DC. So thanks, everybody, and we'll see you at 1 on our Twitter chat. We're going to take the tour, and we can follow up offline for questions. Yeah, we can take a few on topic.
podium, and then any off-topic we'll do from the side. All right.
Dr. Nesbit will be available
Yes.
for that. So could somebody kind of paint a picture for us as to data, why a facility like this is so needed east of the river, say, compared to upper Northwest, and just kind of paint a holistic picture of the whole city and how it breaks out for us?
Sure.
Sure, I'd be happy to. You know, a lot of the conversation, not just nationally but locally, centers around the types of, when we say perinatal health outcomes, what we're really talking about are things related to severe maternal morbidity, which is the type of health outcomes that women have surrounding their delivery of an infant. And most of those tend to be around, sort of as Kyra shared with her story, multiple blood transfusions that happen after a delivery that was complicated, but they can be related to other things that are a complication of pregnancy. And those are disproportionately happening to Black and African American women here in Washington, D.C. The other thing that happens are maternal deaths, which happen, there's kind of two different categories: pregnancy associated, pregnancy related, and they differ between whether or not it was a consequence of the pregnancy or it happened while the woman was pregnant. And those are almost exclusively happening in the district. Over the past 3 years, we've had anywhere from 2 or 3 women annually dying or contributing to our maternal deaths. And we know in 2020, 2019, it is unacceptable for anyone to die as a consequence of being pregnant. Those things should, in large and part, be avoidable. The other thing that we look at is infant mortality, and that means a newborn dying before they experience their first birthday. Our infant mortality rate in the District of Columbia has improved remarkably. We even set for ourselves a goal that in 2020 our infant mortality rate would be less than 5 per 100,000. And we know that most infants who die before their first birthday die within the first month of life, unfortunately, and there's a number of reasons why they don't survive, which could be, they were born too soon, or born at a low birth weight, born with birth defects. But unfortunately, even though we've met our healthy people goal, our infant mortality rate in 2020 is around 4.5. Which again, we met our goal. It's one of the lowest infant mortality rates on record in the District of Columbia since that data has been tracked. But there's a huge disparity between white babies and Black babies. Black babies' infant mortality rate is still close to 7. So it's extremely important that we make people aware of that. And we know that these disparities exist even when we adjust for the mom's education, when we adjust for the mom's income, when we adjust even in some cases for some of the health conditions. So this is not just an issue where we're talking about, Black women are disproportionately experiencing chronic health conditions or have obesity or diabetes, hypertension, etc. Some of these things have to do with the experience of implicit, and I even venture to say explicit, bias, structural racism, etc. So we have to be very focused on how we're going to address all of those things, not only in the healthcare system, but society writ large, in order to have a meaningful impact on Black maternal health.
I appreciate that. Could I clarify the 2 to 3 deaths that you spoke of the pregnant women?
Maternal deaths, so
maternal
they
deaths,
can happen postpartum.
Were they all east of the river?
I'll have to get back to you on the location. I don't believe that they every year were all in Ward 7 and 8, but they were almost exclusively in Black or African American women.
Thank you.
Just to clarify, you said 7 out of every 100,000 children die?
7 per 1,000.
Per 1,000?
Yeah. Okay. It's a different metric. We typically report things per 100,000, but when we look at infant deaths, it's per 1,000.
Other questions? Okay. Thank you, everybody. Let's see this beautiful facility. Thanks for joining us.